Here are the 7 best ways to control pain for hand arthritis. Number 1 is to rest. If you have hand arthritis, you really should be decreasing the amount of activity that you do with that specific part of your hand, whether it's just one finger or your thumb or several fingers. If you can take your whole hand out of most activities, that would be better, because every time you go to move your hand, you're aggravating the joint potentially. There's some muscle imbalances that I talk about in other videos that cause there to be too much pressure in the joints where you've developed arthritis, and activity with the imbalance present just makes it worse. So until you fix that root muscle imbalance, it is just not a good idea to be doing a lot of things with your hand. Of course, you got to take care of some essential activities for life, for the people that you take care of, your work, the things that you have to do. But if you can decrease the amount of things that you're doing and rest your hand, then you should be able to get pain a little more under control. The second one is over-the-counter pain medications. Now, I'm not a physician and I don't tell my patients to be taking certain medications, but they're over-the-counter. They're things that you can go to the grocery store or the pharmacy and get over-the-counter without anybody's permission. And they advertise themselves as hand arthritis medication sometimes. Those medications might give you some temporary relief, especially if you're having pain at night, which often happens in people that have hand arthritis. If you need to get better sleep because your hand is keeping you awake, it might be worth it to use a pain medication for a short time so that you can get some sleep and get to where you can work on fixing the long-term problem. For some people, medications won't work because of stomach issues and other side effects, and pain creams might be a better option for you. That's number 3. Pain creams out there can be of huge benefit to the hand, especially because the hand is relatively easy to get to the joints. You can put a lotion on versus like your back, your lower back. There's a lot of muscles in the way. There's a lot of other tissues in the way. It is very beneficial for many people to put on some sort of hand cream. There's a variety of options out there for you. If you go to the pharmacy section of a department store, you'll find probably at least a dozen options, if not more, for you to try out. My advice is buy 2 or 3 if you've never tried them and see which one works best for you. And if one worked for your knee or your back or some other body part, it might not work for your hand. You might need to try a different one to see if you can get some relief. The next step, if the pain creams don't work, if the over-the-counter medications don't work, is you should probably go to the doctor. If you haven't been diagnosed formally with hand arthritis already, they're going to do that. They're going to take the x-ray, but then they're probably going to offer you prescription medications, which might be a huge benefit for you. However, we know that any medication, whether it's prescription or over-the-counter, it's not intended to be used as a long-term solution. So your doctor's going to tell you, just use this for a short time, because then you will eventually develop side effects, even if it's one that is less harmful for you at the beginning. If the prescription medications don't work and you end up going back to the doctor, the next thing they're going to offer you is injections. You can get injections, steroid injections, into your thumb and your finger joints, and these can potentially give you longer lasting pain relief. However, it still is short term and it's not solving the root of the problem, but that might be worth it for you so you can get some more time getting some rest and being able to enjoy your relationships, and possibly even getting through some times that you just need to use your hands. Maybe you're in a job or a time of life where it's just busy, and the injection might be beneficial for you so that you can endure things. But just know that it is not a good long-term solution to just be getting injections over and over. Most doctors are going to tell you you're limited to just a few a year, because the steroids that are injected into joints are known to break down ligaments and bones and cartilage over time. Getting one injection typically isn't going to do it, but if you get several, that's when it's a bad thing, and they'll limit you. They'll cut you off on the number of injections you can get. Number 6 is using braces or splints. A brace can cover up your wrist and part of your thumb, and splints are usually going to be coverings on the end of your fingers. These are useful because they kind of force you to not use the joint that they're covering up. And it's a way for you to be active a little bit, but still not use that joint. And it might also deter you from using that hand. If you've got a brace or a splint on this hand, then you're likely to do more things with your other hand, which kind of gives you some rest, but you might still be able to grab things, but without that one finger that's covered up, or without that thumb, using that thumb all the way because it's being blocked by the brace. Braces and splints can save you, and the nice thing about them is they're not medications, so the side effects aren't really a big deal. It's just maybe some discomfort from the brace, allergic reactions to the material. There's tons of options out there. There's metal, there's fabric ones, there's custom made ones. You can go to a hand therapy center and get a custom made brace or splint made as well. So there's a bunch of options. You can find the one that works for you if a brace or a splint is going to be the best thing for you. And number 7 is using adaptive tools. There are tons of tools out there to save you from putting too much strain through your finger joints, through your hand muscles. Things like tools to help you open jars and bottles, and using utensils and using hardware tools. There's things that are more accessible for your grip. There's things with special handles on them. There's all kinds of tools out there. If you just do a search on Amazon for hand arthritis tools or hand arthritis equipment, you will find an endless supply of hand arthritis adaptive tools out there that can assist you in being able to do the things that you commonly do, frequently do, or love to do with a little less pressure through your hand joints. Here's the real truth, is all of these things are not fixing the root problem. These things are just short-term, pain-relieving options so that you can get a little more sleep, so that you don't make it worse right now. But you're not fixing hand arthritis at the root of the problem until you begin to fix the muscle imbalance. I talk about that in several videos here on YouTube. I've got them all in a playlist for you down in the description below. It's called the Hand Arthritis Help Playlist. And then I've got a program that goes in depth with my entire treatment approach. It's as if I was there with you, guiding you through step by step through how to get your hand arthritis pain calmed down, how to fix the muscle imbalance, how to get the strength up in the right muscles, and then how to maintain your strength for the long term. There's 4 phases in our program. You can go learn more about this program. It's called the Hand Arthritis Recovery Program. There's a link to it in the description below. If you want more information about the root problem of hand arthritis, check out this video right here. It's called The Secret Cause of Hand Arthritis That No One's Talking About. Check it out.